Hello and welcome to my presentation on anti-inflammatory diet for key elements. So before we go into the diet, let us look at what is inflammation. When our body becomes injured or encounters an infection, it activates defense mechanism to protect itself. It does this by instructing our cells to fight off the invader. This fighting process causes inflammation, which often presents as swelling, redness, and pain. In the short term, inflammation is a sign your body is healing. What we are interested today is to see what is chronic inflammation. So, if inflammation persists for a longer time, it is called chronic. Your body continues sending inflammatory cells even when there is no outside danger. For example, in rheumatoid arthritis, inflammatory cells and substances attack joint tissues, leading to an inflammation that comes and goes and can cause severe damage to joints with pain and deformities. It's important to understand what are the signs and symptoms of chronic inflammation. People experience persistent pain, such as abdominal pain, chronic fatigue or insomnia. You can experience joint stiffness, as in rheumatoid arthritis, skin problems such as psoriasis, and your blood markers could be elevated, such as C reactive protein. People also experience gastrointestinal issues such as constipation, diarrhea, acid reflux. Depression, anxiety, and mood disorders also common in chronic inflammation. People have unintended weight gain or weight loss, and also frequent fever, colds, or flu. So, these are some of the signs and symptoms of chronic inflammation. Let us look at the possible causes of chronic inflammation. It could be due to autoimmune disorders such as lupus, where your body attacks healthy tissue. Exposure to toxins like pollution or industrial chemicals. It could be also due to untreated acute inflammation from an infection or injury, and some lifestyle factors could contribute to inflammation in the body, such as drinking excess amount of alcohol, having a high body mass index that falls within the ranges of obesity, exercise at your maximum intensity too frequently, or you don't exercise enough. So too much exercise at maximum intensity is not good for inflammation. And chronic stress also linked to chronic inflammation. Smoking could also be another cause for chronic inflammation. Many major diseases, including cancer, heart disease, diabetes, arthritis, depression, and Alzheimer's, have been linked to chronic inflammation. So, the main focus of today's discussion is to understand the role of diet. So, the relationship between food and inflammation is well recognized and well researched. Overall, some food components may activate the immune system by producing pro-inflammatory cytokines, which increases the inflammation. So, I know all of you are interested to know what is an anti-inflammatory diet or what foods can decrease the chronic inflammatory process. So there is no single anti-inflammatory diet. However, let us look at the 4 key elements of an anti-inflammatory diet. So the food substances which are high in antioxidants. These compounds help the body fight free radicals or unstable atoms that in high quantities are linked to many diseases. So you can see from the slide that eating lot of fruits and vegetables, and they are high in antioxidants. So the second key element is food substances which are high in healthy unsaturated fatty acids. Monounsaturated fatty acids and omega-3 fatty acids are found in some fish, especially sardines, mackerel, salmon, and tuna, seeds, nuts, and plant-based oils. So these are all good to fight off the chronic inflammation. The third key element is foods which are high in fiber and prebiotics. Carrots, cauliflower, broccoli, and leafy greens are good sources of fiber and prebiotics that promote the growth of beneficial microorganisms in our intestines and can come from onions, leeks, asparagus, garlic, bananas, lentils, and legumes. So these foods are good in chronic inflammation, and they will reduce these food substances help in reducing the inflammatory process. The last element or the fourth key element is to decrease processed foods in our diet. So these contain refined carbohydrates such as pastries, pies, sugar sweetened beverages, deep fried foods, margarine, processed meat, sausages are some examples of processed foods. So it's better to have fresh ingredient or mono ingredient foods when compared to the tin or bottled or packaged foods. For example, fresh tomatoes are better than canned tomatoes, because canned tomatoes, if you see the ingredients, you will see many other ingredients other than tomatoes. And fresh juice better than packaged, bottled, and bottled processed juices. So in conclusion, natural foods are anti-inflammatory when compared to processed foods. So I would like to post another video which is on research on anti-inflammatory diet and specific diseases. That will be the next video. So if you find this information useful, please like, share, and subscribe. Thank you for watching.